QRS frequency therapy is proven technology, and it has also been proven to be effective in treating the main symptoms of the COVID-19 virus. In this video I explain the conclusions of a recent professional study carried out on 52 patients who suffered from pneumonia following infection by the COVID-19 virus. And this study clearly proves that if you suffer from pneumonia and you use the technology of PEMF, in which QRS is the technological leader, you're going to see significant improvements, and these improvements are going to be better than all the other standard therapies. For example, you're going to see a strong improvement in vital capacity of your lungs. In chest excursion, you're going to see an improvement in breathing and a reduction of restlessness. There's going to be a strong reduction of disabilities, and there's going to be a strong improvement in the quality of life, such as everyday activity, general mobility, reduction of pain and discomfort, and reduction of anxiety and depression. So keep watching. Hello, thank you for watching this video. This is Dr. Emil. Today I am in Addis Ababa in Ethiopia, and I'm helping various doctors to treat their patients suffering from a whole range of different chronic diseases using the QRS, and in particular using the QRS Pain Rescue Pillow Applicator. So in the study that I mentioned in the introduction, this study comes from Russia. Why Russia? Because Russia for the last 40 to 50 years has been at the forefront. It has been a front runner together with Germany in the research and development of this important technology called PEMF, which stands for pulsed electromagnetic frequency therapy. Already in Russia there's at least 1,000 really professional clinical studies proving the effectiveness of this therapy. Unfortunately, most of these studies are in a Russian language. Also in Russia, as opposed to many Western countries, they look at PEMF, they put it in the box of alternative medicine, but it is not alternative medicine. It is proven medicine. It is proven by hundreds of professional studies, and in Russia, PEMF is accepted as part of mainstream medicine. I myself, I lived in Russia. It's a fantastic country, and if you walk into a hospital there or in an office of a private doctor, there's a good chance you're going to see some PEMF system there. So doctors in Russia offer PEMF to their patients to help them reduce their chronic pain and improve their chronic disease without side effects. Back to the study. So the study involved a study of 52 patients who suffered from pneumonia following infection with the COVID-19 virus. The average age was about 56 years of age. They were taken 16 days after having been relieved from the hospital, so still suffering from the pneumonia. And these 52 patients were divided in two groups. One group was the control group, 22 patients. They received for 10 days the standard rehabilitation therapy, which in Russia is high quality. But the other 30 patients, they did not receive that therapy. Instead, they received PEMF therapy for 10 days, only 10 days, and every day only 20 minutes. Before I explain the findings of this study, first a few notes on pneumonia. Pneumonia is an infection in one or both of the lungs, which results in inflammation of the air sacs of the lungs, the so-called alveoli, which get filled with fluid and pus. Many symptoms, the main symptoms are coughing and shortness of breath, also chest pain, migraine, loss of appetite, tiredness, fatigue. It is important, pneumonia is not just affecting your lungs, but because of the poor blood circulation, the poor oxygenation, it also affects other organs such as your brain and your heart. Now let's get back to the study. The study used various professional evaluation methods including spirometry, rehabilitation, routing skill, questionnaires on quality of life. There was also a skill called the Borg skill, which is an assessment of everyday activity. Every patient was taken electrocardiogram, and last but not least, they measured for every patient with the pulse oximeter the oxygenation of your blood. And as you know from other videos on this channel where I stress that if you use the QRS therapy, it will always result in a strong improvement of oxygenation of your cells and tissues. Findings of the study carried out in Russia by various doctors, including by Professor Bodrova. The study is published in PubMed under number 333-07658, and in the description of this video you can find a link for seeing the whole study report. The study included 52 patients which were divided in two groups. The first group consisted of 30 patients who received PEMF therapy 10 days and every day 20 minutes only. The second group is the so-called control group, and this group received therapy in accordance with the temporary clinical recommendations of the Ministry of Health of the Russian Federation for the prevention, diagnosis and treatment of the new coronavirus infection COVID-19, as well as in accordance with the temporary clinical recommendation for medical rehabilitation for a new coronavirus infection. So what are the findings? If you compare the results of the first group, they are significantly better as that of the second control group. For example, vital capacity of the lungs was 16.4% better in the PEMF group as compared to the control group. There was a significant increase in chest excursion that was 45.6% better in the PEMF group as compared to the control group. There was also a significant improvement in the decrease of the level of shortness of breath from moderate to mild, 64.1% better in the PEMF group as compared to the control group. Also, the decrease in the disabilities was 62.7% better for those patients who used PEMF as compared to the control group, and the improved quality of life was also significantly better. General mobility 44.5% better when you use PEMF. Everyday activity 26.1% better when you use the PEMF. Decrease in pain and discomfort 47.9% better when you use PEMF, and decrease in anxiety and depression 42.2% better when you use PEMF in rehabilitating after pneumonia as compared to the control group. At the end of this video, a quick summary. The objective of this study was to determine the effectiveness of PEMF in treating pneumonia, and the conclusion is very clear. PEMF QRS frequency therapy is essential for when you are suffering from any respiratory disease. It's not just pneumonia, also asthma, bronchitis, COPD. Please look at some other videos on this channel. You will find that QRS is essential, and if you are suffering from one of those diseases, I strongly recommend you to buy the system and to use the QRS every day in your house. This is the end of the video. If you like this video, please click on the like, but more important, if you are interested to get more information on real clinical studies, evidence about the PEMF technology and about QRS, then please click on the subscribe button. I thank you for watching.